And can I thank the members who brought this motion here today. And I'm coming at this from the perspective of the human side of cancer and the suffering it brings to the individual and to their families, their friends. Cancer is one of the worst diseases to hit this community. It doesn't know any barriers at all. It affects the young, it affects the old, it affects everybody, male and female. And whilst we should be doing more today to try and stem the tide of this disease, we see now that we've got a minister who's not only is not at his desk, he's not even here. And I hope when he looks at this here on television today, that he's sitting at his desk watching this debate, and in a way he feels happy with himself, that he's already stated publicly that he's at his desk every day doing his job. Well, why is he not in here doing his job? I would... Sorry.
Thank you for giving way. Would the member agree with me that perhaps there is a bit of a discrepancy here in that Mr Hamilton's public utterances suggest that he may be uncomfortable with what the DUP are doing, and he is at odds, in fact, with his leadership in that regard?
The member has an extra minute.
Thank you, and thank the member for his intervention. That may be so, because that's something that I'll come to in a moment. What I would say to the minister today is, if he would take his ministerial car and go to the city hospital any day of the week, and you get into the waiting room where people from all over the 6 counties here are in for treatment, there's people there from Fermanagh, Enniskillen, all round, who have to stay in Belfast during the week from Monday to Friday and wait for their half-hour's treatment every day, and the rest of the day they have to stay in Belfast and go home on a Friday. Those are people who are sitting up there every week and their families at home. There's children there, 4 and 5 years of age, getting wheeled in wheelchairs for treatment. The elderly coming in wheelchairs. It would break your heart to see some of the people there. And whilst we have that suffering going on day and daily, we have people here playing footsie with this whole thing because of their political aspirations. This is not what the public wants. The public wants you sitting here doing something. This is not a political issue. This is a human issue. And I'm stating that coming from today. I'm standing here today speaking on this here as a cancer patient myself. I'm presently going through my 5-year programme of treatment for my cancer. And I know this from first-hand experience, what suffering I see when I go into the waiting rooms there and I see the people there. Those are the people who are looking for hope. Families there that have their husbands, their mothers, brothers and sisters all getting treated. And whilst we haven't got a minister here at the desk to give direction, waiting lists are getting longer. Some cases now up to a year and a half waiting after a referral from the GP. And the consultants now have to go through that there and prioritise the list. We had the case in the Causeway Hospital last year where we had results of biopsy tests sitting in the hospital, but we had no consultants to give out the results of those tests to the patients. And therefore the mental strain and the suffering goes on, waiting to know, do I have cancer, do I not have cancer? And if I do have cancer, what treatment am I going to get? Am I going to get radiotherapy? Am I going to get chemotherapy? Or am I going to get an operation? All of that suffering's going on. What we see now is not only politically corrupt, it's morally corrupt. And if those people have any sense of morals in them at all, and some of them do tell us that they are deeply religious, where is their religion? And where is their morals today when people are out there suffering and dying? Families are getting decimated by this disease, and no one there to give leadership. If you cannot give leadership, step aside and let somebody else take the seat. And I do believe there's people within the DUP don't believe in this hokey-cokey kind of politics that they're pursuing today. And it may be something you can sit and smile at, but I hope to God the disease never hits your door, because you will not smile then. And you will hope you have somebody there that will give direction and will cut the waiting list down. I'm working day and daily with people in my constituency of East Antrim, trying to get them in from referrals from their GP, trying to get them in after 6 months, and I'm still waiting for a referral. I'm trying to get their test results out after they have their referrals. And this is going on, and it would break your heart. And we're still seeing this depraved kind of politics that we're seeing from this party here, playing politics with people's lives. It should be a shame on you. And don't ever hold your head up in public again and say you are working for the people. If the one thing that you can't stand is come in here today and show leadership to those people who are suffering from one of the worst diseases that we could have.
Ask the member to conclude his
It's a
remarks.
total shame on you, and I support the motion.